The button next to your name in WebAcute has a number of important functions. It allows you to select multiple patients. Remember, by default, if you were to click on any of the patient records, MEDITECH would select that patient's chart. You could then click on Chart to view the contents of the chart, click on Document to create electronic documentation, or click on Orders to review current and past historical orders. If you were to click Select Multiple Patients, you get a slightly different view, which allows you to click and select several patient records at the same time. Next menu allows you to add a patient to your list. When you click on it, you could search for a patient by name, account number, this is the visit number, medical record number, and other parameters. When the patient is found, you could select to add the patient to your list. Clicking Report brings you to standardized MEDITECH reports. If you would like to create a report based on your list, whether a simple one-line, slightly more sophisticated, expanded, or a two-line table report, clicking Print would allow you to either preview or print. Preview is the default. And this shows you what your patient list would look like. You can select a single patient record and use this menu to add the patient to the provider team. Provider teams which had been built are listed here. You can select any one of them or multiple provider teams and choose to save the patient into this provider team. As you can see, this patient is already added to a provider team called Cardiology A. If you actually wanted to provide coverage for the service, you would click the Edit Coverage button, Provider Teams, and add the provider team you would like to cover for to your list by clicking Save. Additional functions of the menu allow you to remove a selected patient from your list, to add a selected patient to the personal list of patients you would like to follow potentially after they've been discharged, to restore a removed account. This refers to bringing patients you have previously removed from your list back on your list, and signing up to patients as their admitting, attending, primary care, family, or other provider.